They have told you that eating nuts is good for your health. But after more than 30 years of working with older adults in the United States, I must tell you a truth that almost no one dares to admit. Some of the nuts you eat every day may be quietly harming your heart, raising your blood pressure, clouding your memory, causing joint inflammation, and even damaging your circulation while reducing your masculine strength. The frightening part is that these are the most common nuts found in the kitchens of older adults. I am Dr. Mohit Kara. My mission for more than 3 decades has been to help men and women over 60 regain their energy, memory, strength, and confidence in life. I have seen patients who simply changed a few types of nuts in their diet, and the results truly surprised them. Their blood pressure became more stable, their minds felt clearer, their sleep became deeper, their circulation improved, and their sense of youthfulness returned. But I have also seen others who believe that nuts are always healthy, and their health declined without them knowing the reason. In this video, I will help you identify 4 types of nuts you should eat every day to support your thyroid, your joints, your brain, your heart, and your blood sugar. And just as important, I will show you 4 types of nuts you need to avoid immediately because they can increase inflammation, interfere with the medications you are taking, affect your kidneys, or quietly increase your risk of weight gain, which many people over 60 experience. And at the end of the video, I will reveal the most dangerous nut, the one many older adults believe is harmless. Yet studies have linked it to memory decline and liver damage. It may be sitting right inside your kitchen cabinet. Good nut number 1, Brazil nuts, for thyroid support and testosterone. After the age of 60, the body begins to lack many essential micronutrients that you may not notice right away, yet they strongly affect your energy, your memory, and your masculine strength. One of these is selenium, a mineral that acts like the switch that activates your inner power as you age. And the food that contains the highest natural amount of selenium is Brazil nuts. The wonderful thing about Brazil nuts is that just one small nut provides more than 130% of your daily selenium needs. For older adults, this is a major advantage because the body enters a stage where it absorbs and metabolizes nutrients less efficiently and needs concentrated, easy-to-use nutrition. The selenium in Brazil nuts is not a synthetic form. It is attached to organic molecules that allow the body to absorb it more naturally and safely. Why is selenium so important? Because it is the key to keeping your thyroid working properly. The thyroid controls your metabolism, your energy, your body temperature, and the clarity of your mind. When the thyroid becomes weaker, which is extremely common after the age of 60, you may feel tired, have cold hands and feet, gain weight quickly, experience mental fog, and feel as if your masculine vitality is fading away. Not only that, selenium also plays a role in testosterone production. Most men think testosterone is only related to desire, but in reality it affects sleep, mood, muscle strength, confidence, and how well the body responds. After 60, testosterone naturally declines, but a lack of selenium makes this decline much more severe. Getting the right amount of selenium helps the body regulate testosterone naturally and safely, instead of relying on medications or external hormones. In addition, Brazil nuts contain healthy fats that help protect the myelin layer, which is the protective covering of your nerves that allows brain signals to travel quickly and accurately. When the myelin is healthy, you will notice better reflexes, sharper memory, and a clearer connection between your mind and your body. The most important thing to remember is that Brazil nuts are so potent that you should not eat too many. The optimal amount for older adults is 1 to 2 nuts per day, stored in the refrigerator to keep the natural oils from becoming rancid. This small daily habit alone can create a significant change in your thyroid, your energy, and your hormones. Good nut number 2, almonds for bone protection and brain health. Among all the nuts older adults can add to their daily diet, almonds are one of the safest, strongest, and most reliable choices. They are not only a healthy snack, but also a natural shield for your bones, your memory, your energy, and your digestion, which are all areas that decline quickly after the age of 60. After middle age, the body begins to lose bone density. This makes older adults more likely to fall, suffer fractures, develop degeneration, and experience long recovery times. Almonds contain calcium, but what makes them truly stand out is their high magnesium content. Magnesium acts like a guide, directing calcium to the places where it is needed, which are the bones and teeth, instead of letting it drift into the arteries where it can cause calcification. For older adults who are at risk of weak bones or osteoporosis, this combination is invaluable. Not only are they good for your bones, almonds are also one of the best everyday foods for your brain. When you eat them with the thin skin still on, you absorb flavonoids, which are powerful antioxidants that help protect brain cells from age-related damage. Combined with the natural vitamin E found in almonds, this duo works like a filter that clears away free radicals that cause memory decline, slow reaction time, and make you feel less sharp as you get older. Research from Tufts University shows that eating almonds regularly helps improve memory, information processing speed, and mental clarity, which are the abilities older adults fear losing the most. In addition, almonds help stabilize blood sugar, regulate your energy throughout the day, and reduce glucose spikes after meals, which is a common issue for people over 60. For digestion, the fiber in almonds helps improve bowel movement and reduce constipation, a condition that nearly half of older adults experience but hesitate to talk about. When your digestive system works well, your whole body functions more smoothly, from your mood to your mobility. For older adults, the important thing is not eating a large amount, but choosing the right kind. I often recommend that my patients have about 15 to 20 almonds per day, either raw or dry roasted, with no salt and no sugar. If your teeth are weak, you can soak almonds for 4 to 6 hours to make them softer while keeping all the nutrition. Almonds are the quiet protector of the body after 60. They are small and simple, yet their impact is stronger than you might expect. Good nut number 3, walnuts, the best food for the brain and for sleep. Walnuts are one of the greatest gifts nature has given to older adults, especially for brain health and sleep quality. If you are over 60 and have started to notice that you forget familiar names, lose focus during conversations, or wake up in the middle of the night and cannot fall back asleep, then walnuts may be the nut you need to add to your daily diet. The first thing that makes walnuts stand out is their ALA content, which is a plant-based form of omega-3. Unlike many other types of fats, omega-3 is brain nutrition that helps nerve cells maintain flexibility and communication. As we age, the membranes of brain cells become stiffer and less flexible, which leads to memory decline. The ALA in walnuts helps soften those cell membranes and keeps the flow of signals in the brain fast and smooth. Walnuts are also rich in polyphenols, which are antioxidants that can enter brain tissue and reduce neuroinflammation, one of the factors that contribute to Alzheimer's, Parkinson's, and age-related cognitive decline. This is especially important because silent inflammation in the brain does not cause pain or fever, yet it slowly destroys your memory, your clarity, and even your personality over time. Another strength that few people know is that walnuts contain natural melatonin, the hormone that regulates your sleep and wake cycle. As you get older, your body produces less melatonin, which makes it harder to fall asleep, causes light and restless sleep, and makes you more likely to wake up at 2 or 3 in the morning. Adding a small amount of walnuts in the evening helps your body return to its natural rhythm and improves sleep quality without the need for sleeping pills. Research from the Journal of Nutrition shows that older adults who ate walnuts every day for 8 weeks had better memory, faster reflexes, and more stable mood. This is the real result I have seen many times in my clinic. When the brain is nourished properly, everything else in life becomes easier. I often advise my patients to eat 7 to 9 walnut halves each day, stored in the refrigerator to keep the omega-3 fats from oxidizing. If you are not used to the slightly bitter taste of the skin, remember that it is the skin that contains most of the polyphenols, which are the true source of strength in walnuts. Walnuts are not a miracle, but they are one of the most powerful tools to help you protect your memory, maintain clarity, and achieve deep sleep, which are the things age tries to take away from you. Good nut number 4, pistachios for heart health, eye health, and blood sugar. Among all the nuts that are good for older adults, pistachios are often the most underestimated, yet they offer benefits that few other nuts can match. For people over 60, when the heart becomes weaker, vision declines, and blood sugar becomes more unstable, pistachios become a powerful and natural triple protector. The most outstanding feature of pistachios is their very high potassium content. Potassium is a mineral that older adults are often deficient in, especially if they are taking blood pressure medications or diuretics. When potassium is low, the blood vessels become stiff, which raises blood pressure and forces the heart to work harder. Just one serving of pistachios per day can provide an amount of potassium comparable to many fruits, helping relax blood vessels and support more stable blood pressure through a completely natural mechanism. Pistachios also provide excellent benefits for aging eyes. They contain lutein and zeaxanthin, two carotenoids that act as the eye's shield against blue light. After the age of 60, the risk of macular degeneration and cataracts increases significantly. Eating pistachios regularly helps protect the retina, reduce oxidative damage, and support clearer vision. This is why older adults who eat pistachios often tend to see more clearly, experience less glare, and feel less eye fatigue when reading or watching TV. But what makes pistachios a top choice for older adults is their ability to help stabilize blood sugar. Thanks to their high fiber content and low glycemic index, pistachios slow down the absorption of sugar and prevent sudden spikes after meals. This is especially helpful for those with prediabetes or type 2 diabetes, which are very common among people over 60 in the United States. One more small but important benefit is that pistachios still in their shells help you eat more slowly, create a faster feeling of fullness, and prevent overeating. For older adults who need to manage their weight, this habit is very helpful. The ideal amount is 1 ounce per day, choosing unsalted or low-salt varieties to protect the heart in the best way. The 4 nuts we just discussed create a wonderful foundation for protecting your heart, brain, bones, and blood sugar after the age of 60. But the story does not end there, because along with the good nuts, there are 4 types of nuts older adults should completely avoid. Not because they are bad, but because the body after 60 becomes more sensitive, more prone to inflammation, more affected by medications, and slower to recover. And the surprising part is that many people still eat them every day without realizing it. Now let us begin with the first one. Bad nut number 1, peanuts, the inflammation and aflatoxin bomb. Peanuts are one of the most common nuts in the United States. They appear in every kitchen, in snack boxes, at parties, and even in the daily diet of many older adults as a so-called healthy food. But the truth is that peanuts are not nuts, they are legumes. And because they are legumes that grow underground, peanuts carry a risk that few older adults know about, which is aflatoxin, a mold toxin that can harm the liver, weaken the immune system, and increase inflammation in the body. Aflatoxin has no smell, no taste, and cannot be seen with the naked eye. But once it enters the body, it puts pressure on the liver, an organ that naturally becomes weaker with age. Younger people can handle a small amount of aflatoxin without much trouble, but after 60, the liver loses its ability to detoxify quickly, which allows the toxin to stay longer and cause more harm. This is especially true for those who are taking medications, drink alcohol lightly each week, or have a history of elevated liver enzymes. For them, peanuts become a real burden. In addition to aflatoxin, peanuts have another characteristic that few people pay attention to. They can trigger silent inflammation. Even if you are not allergic, peanuts can still activate a mild but persistent inflammatory response that affects your joints, your heart, and your brain. For older adults who are already prone to joint pain, fatigue, and memory decline, the inflammation caused by peanuts can make these symptoms worse without you ever suspecting the cause. Another issue is the sodium and low-quality oils found in commercial peanuts. Most peanuts sold in supermarkets are oil roasted and salted, sometimes with a very high amount of salt. After the age of 60, the body becomes more sensitive to sodium, which can cause blood pressure to rise sharply even from small, everyday foods. Salted peanuts can push your sodium intake far beyond the limit recommended by the Heart Association for older adults. Not to mention that many varieties also contain added sugar, preservatives, and hydrogenated oils, all of which contribute to higher levels of bad cholesterol. It should also be said that peanuts contain a large amount of omega-6, a type of fat that, when consumed in excess, can create an imbalance with omega-3 in the body, which leads to increased inflammation. For older adults who are trying to reduce joint inflammation, improve memory, or support heart health, an omega-6 to omega-3 imbalance is not helpful at all. I am not saying that eating a few peanuts will be dangerous, but if you are over 60 and you eat peanuts regularly, especially salted roasted peanuts, this is the time to reconsider. There are other choices that taste better, are safer, and are much more suitable for your aging body. Bad nut number 2. Cashews have a creamy, soft texture and are very easy to eat, which makes many people believe they are a safe and healthy nut. But for the body after the age of 60, cashews contain several silent risks you need to pay close attention to. The first concern is blood sugar. Cashews have a higher carbohydrate content than most other nuts, and their glycemic impact is greater than you might expect. This makes them likely to raise blood sugar soon after a meal, which is especially dangerous for those with diabetes or prediabetes, two conditions that are very common in older adults. Cashews not only cause blood sugar fluctuations, they also contain oxalates, compounds that combine with calcium in the body and form kidney stones. After the age of 60, the kidneys become weaker and their ability to filter oxalates decreases, which significantly increases the risk of stone formation. Kidney stones are not only painful, they can also lead to infection and long-term kidney damage. Another issue that is rarely discussed is the soft and slippery texture of cashews, which makes them a choking hazard for older adults, especially for those who experience dry mouth from medications, have weak teeth, or have difficulty swallowing. And although they are labeled as raw cashews, they are all heat-treated because truly raw cashews contain urushiol, the same toxin found in poison ivy. This process removes part of their original nutritional value. Cashews are not the worst nut, but they are not suitable for people over 60, especially if you have concerns related to blood sugar, your kidneys, or your teeth. Bad nut number 3. Macadamias have a rich, creamy, luxurious flavor, which makes many people believe they are a healthy snack. But for the body after the age of 60, this nut carries more risks than you might think. The biggest concern is the extremely high amount of calories and fat. Just a small handful of macadamias contains nearly 200 calories and more than 22 grams of fat. With metabolism slowing down after 60, these calories can easily turn into stored fat without you noticing. This is what we call silent weight gain, slow and subtle but steady over time. Macadamias also contain a higher amount of saturated fat than many other nuts. For those managing blood pressure, cholesterol, or heart disease, this type of fat can increase LDL cholesterol and place additional strain on the cardiovascular system. This makes macadamias far from an ideal daily choice for older adults. Another risk that is rarely mentioned involves the gallbladder. Many people past 60 have gallstones without knowing it. When you eat foods that are too fatty, such as macadamias, the gallbladder is forced to contract more strongly, which can cause stones to shift and trigger pain, nausea, or even gallbladder inflammation. I have seen many older patients hospitalized simply because they had no idea the problem started with a harmless handful of nuts. Finally, macadamias are very hard. For those with weak teeth, dentures, or dental bridges, the risk of cracking or breaking a tooth is very real. For these reasons, macadamias are not an ideal choice for people over 60. There are many safer and more beneficial nuts available to you. Bad nut number 4. Pine nuts are a nut many older adults enjoy because of their mild, buttery flavor and their frequent use in Mediterranean dishes. However, for the body after 60, they are actually one of the riskiest nuts and should be carefully reconsidered before being eaten regularly. The most common risk is a condition called pine mouth, a taste disturbance that appears 1 to 3 days after eating pine nuts. All foods, even plain water, may taste bitter or metallic. Younger people can tolerate a few days of discomfort, but for those over 60, losing the sense of taste can lead to reduced appetite, poor food intake, dehydration, or weight loss, which can quickly lead to weakness, dizziness, and exhaustion. Equally important is the potential for medication interactions. Older adults often take several medications each day, from blood pressure and cholesterol medications to antidepressants. Pine nuts may affect liver enzymes responsible for metabolizing these drugs, causing medications to become weaker or stronger than intended. This increases the risk of side effects or reduces treatment effectiveness. In addition, the fats in pine nuts oxidize easily, especially when stored for too long or kept improperly. Oxidized fats cause inflammation, which contributes to joint pain, fatigue, and memory decline in older adults. Pine nuts are also small and slippery, making them a choking risk for anyone who has difficulty swallowing or experiences dry mouth from medication. For all these reasons, pine nuts are not the best choice for people over 60. When I look back at more than 3 decades of working with older adults, I realize that our health never changes only because of big events. It changes because of the small things, the habits we repeat every day, and the choices that seem harmless but accumulate over time. A handful of the right nuts can bring energy, clarity, and a light, comfortable feeling in your body. But a handful of the wrong nuts can open the door to inflammation, unstable blood sugar, sleepless nights, silent weight gain, or memory that slowly weakens with the passing years. The important thing I want you to remember is this: you are never too old to change, and your body has never stopped listening to you. Whether you are 60, 70, or 80, your body still has the ability to recover, adapt, and improve when you give it the right building blocks. And today, you know exactly where those building blocks are: in the 4 powerful nuts that most older adults overlook, and in avoiding the 4 nuts that seem harmless, but are actually putting pressure on your heart, kidneys, brain, and overall vitality. You do not need to change everything at once. Just start today. Replace peanuts with pistachios, replace cashews with almonds, add 1 Brazil nut each morning or a few pieces of walnuts in the evening. These small changes will create big improvements that you can feel week after week. If this video has given you knowledge, hope, or a new perspective on health after 60, please press like to support the channel. Press subscribe and turn on the notification bell so you do not miss the important health lessons made especially for the senior community. And if you are ready to take care of your body the way it deserves, leave a comment under the video. I'm ready.